Make sure you clean the area for sure, right? You're asking if they have any allergic reactions to the medication that you're going to be putting on. Okay, what else is different?
You have to like put it on with a glove.
Right, put on a glove, then put on the medication because you don't want to numb your own hand. Okay, you don't want to be trying to treat somebody and go, I can't even feel it. Okay, so you want to rub that area. What goes on first? The medication. The medication goes on first, and then put gel on top of that, right? Okay. What settings? Non-thermal. Why? It's not necessarily about deep or superficial. It's because
Accessory medication.
nope, wrong again.
It can break down the medication or cause changes chemically to it.
No, wrong again. Okay. The reason is you're applying a medication that most times reduces inflammation and pain, right? So you make that area super numb and then you start heating it up. If you're burning that patient, you might be burning them and they not even know it. Does that make sense? And so that's why you always keep it at 20%. Okay? All right. Any other questions over that? Okay, so lumbago, just low back pain and a rotator cuff tear that we're looking at. Previous medical history, he's got hypertension. Obviously, he also has lumbago and rotator cuff tear. So medications, hydrocodone, that is an anti-inflammatory. That's going to be your phonophoresis medication. What is lisinopril? Anybody know? Blood pressure medication. Those are one of the common ones you'll see. So just be kind of aware of those.
So for this one, like with medication, hydrocodone is a narcotic, right?
No, hydrocodone is just an anti-inflammatory.
Oh, it is? I thought
Hydrocodone.
Oh no, it does come with
it's
that's right.
Vicodin.
Yeah. It does have
So
analgesic in it.
when you're doing like a transfer, you might want to do a squat pivot or something because they're gonna. Is that kind of what we need to be thinking about? Because
so
they're
you
gonna
might
be a little loopy.
well, and the other thing you need to be concerned about, and you're right, hydrocodone. My brain was just not right because I was thinking hydrocortisone, and I was wrong. So hydrocodone that's OxyContin basically. Okay, that is a medication. So you will have to watch them. They might be a little loopy, might not. I wouldn't necessarily insist on a squat pivot, but you might say, I'm going to be aware that they might be a little bit off balance. It doesn't really always affect all people, and so it's not something you absolutely have to do, but it's just something you want to be aware of. The other thing you would want to be aware of also is they're going to have a higher pain tolerance, so you want to be careful. Just because they don't say something hurts, you don't want to overstretch or over pull because they're on that medication. So lisinopril is high blood pressure. Hydrocortisone, not hydrocodone, is the anti-inflammatory that I was speaking of. It is just an anti-inflammatory. It is anytime it's izone, okay, you're almost always looking at steroid. Okay, prednisone, hydrocortisone, can't think of any of the other ones. But izone at the end is almost always going to be a steroidal treatment, just so you kind of know that. So anyways, and that's what you're going to be using for your phonophoresis. I just saw that. I literally saw that and read hydrocortisone. Anyways, so be careful of that. Obviously, those are pretty similar. So your patient is a 53-year-old male who suffered a fall 2 weeks ago off a ladder at home. So 2 weeks, automatically I'm going, okay, this is not really acute, but not really later on, so it's kind of in this in-between stage, so I at least got to be aware of that. I'm definitely going to be looking for inflammation, okay? If it's inflamed already, I know that I'm going to want my treatments to be more like an acute type treatment. If it's kind of looks like it's moved out of that, then I might go thermal. Does that make sense? Because it's kind of on the fence a little bit. And so that's where feeling it and looking at it is going to become kind of more important. Okay? All right. So, right rotator cuff tear when he fell, so we know that's 2 weeks ago also. He is going to manage it non-operatively, which lets you know it's only a partial tear. They would never let them, I mean, ultimately it's still his choice, but if it's a full tear, there's not anything you're going to be able to do with it, okay? So he's got a partial tear. If it's a rotator cuff tear, where is it almost certainly going to be? Supraspinatus. Supraspinatus. Okay, so we know that's this area right here, and so this is where 116 in Christina's class become important. So it's on his right side. He is having less pain in his shoulder, but is still having difficulty with range of motion now. Less pain, this cues me that he's probably started to move out of that inflammatory phase. I'm still going to look at it, but I'm getting a cue here, right, to be aware of. Since the fall, he's also had recent flare-up of low back pain. He has had so a flare-up, that lets you know what? This is more of a chronic type condition that he's had for a while, but this is a flare-up. So this actually runs the same thing though. Just because it's chronic, it's a flare-up, which could have meant a re-injuring of that, right? So you'll have to kind of look and think about it and be smart here too. So he's had an MRI imaging and has been cleared of any spinal fractures or herniated discs. So we know there's no fractures, we know there's no herniated discs there, so he's good to do pretty much anything as long as it doesn't overly, like really increase pain to injury kind of pain, and it's not increasing inflammation, okay? So the doctor says it's just muscle spasms. Ding, 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 muscle spasms, that should give you a hint too, right? What kind of treatments are good for muscle spasms? Heat. Okay, so automatically I'm thinking as I look at this, okay, I'm probably going to do heat on his back. And depending on where the shoulder's at, as I look at it, I might do heat, I might do ultrasound, I might do ice, okay? Just looking at it without that stuff, because in real life, it's not going to tell you phono, hot back, ice massage. You're going to have to make those decisions, okay? So I'm going to try and train you guys right. So just in real life, though, I'm immediately going hot pack or some type of heating for the low back, and I'm kind of still on the fence about the shoulder, okay? So I would look at it and see. Doctor says just muscle spasm, we got that. Patient has been using a wheelchair because of recent pain in his back due to the narcotic medications, hydrocodone, which you guys are right about. The patient is unstable transferring from the wheelchair, so now we know he's unstable, so maybe I would actually go, if he's unstable, I'm going to do a squat pivot maybe, because I don't want him going down on me, okay? So you meet with the PT and you discuss the current plan of care for this patient. The PT orders modalities including hot packs, ice massage, phonoparesis, active assisted range of motion, PNF, and transfer training. Okay, so good enough. So the PT just throws these things at you, and then you have to decide which of these you're going to do and why or why not at that time, which is real life. Okay, so in no particular order here, these are the interventions that need to be demonstrated. So in the test, it will tell you, but I also want you guys to start thinking about these things, okay? Because in real life, it won't. It'll just say, you'll pretty much just get what's going on with the patient, their history, and then what things have been approved by the PT, and you got to make your decisions, okay? So that's why I want you guys thinking about these things. Blood pressure's okay, little bit high on the low end there, little bit high technically on the middle, but anything below 140 is just, you don't even have to mention it, you just have to watch it, okay? Once you get into the 140s, 150s, 160s, 150s, 160s especially, that's something you want to pay attention to, okay? Stats are 95%, nothing to worry about there. Heart rate's right in that sweet range. Transfer training, So this guy is unstable. We also know, so if you're just doing a transfer, then yeah, I'm going to squat pivot him. But PT ordered me to do transfer training, so my earlier thinking, I'm actually probably going to change, right? Because if I'm training somebody to transfer, would I train them to do a squat pivot? No. It's not a safe transfer, not to do on your own. So even though I'm working with them, I'm looking at this now and I'm going, I need to train him on safety, even while he's taking his hydrocodone, on how to do a safe stand pivot transfer to make sure he's stable. Maybe I'm getting him a cane possibly to add extra stability to it, or something along those lines. Now, obviously you guys haven't been trained in canes yet, so I wouldn't worry about that, but I'm just explaining to you real life, okay? So, but I would definitely show him, have a hand on the wheelchair, extra hands on the bed, all those things to go very slow and very careful and make sure he's all in position, okay? So stand pivot transfer as far as training. Now if I'm just having to do one transfer with him, I might get him set up and ready, and then as I go into transfer training itself, I'm going to train him on a stand pivot, okay? Or a sit to stand, maybe even to start. Okay, so moist hot pack to the low back. We already determined that just based on what it tells us. Muscle spasms, that's going to be your best treatment for it. So to the right shoulder, we've got both phonophoresis and ice massage. And we know that because of the medication. So which would you do first and why? What do you think? So we got some dissension. Here, I'll tell you my thinking. There's actually not a right or wrong answer technically with this. And this is what we talked about a little bit yesterday. It's clinical decision making. And like Katie said, if you can explain why you just made that decision and it's a good, proper, thought out decision, it's probably going to be okay. There actually isn't a right or wrong answer. But having said that, I would actually do ice massage first, and I'll tell you why. I can get them set up for the hot pack and do ice massage at the same time, right? And so I'm going to save myself a bit of time that way, okay? I cannot do phonophoresis and anything else at the same time because there's no way I can let go of the ultrasound head and check it. The other thing that I'm thinking here is if I ice massage that shoulder, I'm really kind of numbing it, you know, and so I don't know. I just kind of think my personal, and so it's just, there is a balance to it. But since I know I'm going to probably want to be doing some PNF and range of motion with them on that shoulder, I think I might want to kind of ice it, get it numb, get it feeling kind of comfortable, and then finish with the phonophoresis. Okay? Not a right or wrong answer there, really. Okay? But that's how I would do it, and that's kind of my thinking.
I remember you saying too, like end with heat is always nice.
Right. Patients do love to end with heat if you can, and so that would be another way you could do it. You could start with phonophoresis and then end with hot pack and ice massage.
Well, so when we want phonophoresis.
So either way. Like, I mean, you can do it that way. And so it really isn't wrong. My thinking, though, is just, I'm going to loosen him up, I'm going to numb some pain there, and then I'm going to be able to get a little bit more out of him, but I can finish with that numbing agent with phonophoresis.
So is he going to be non-thermal for that? For the fact that it's a flare-up would also make it non-thermal, right? Because
it's phonophoresis, right? So non-thermal no matter what. So that doesn't even actually end up factoring. I can look at it and I actually do want to see, but this indicates, because it's ordering ice for you, that there's still some inflammation there here, but not here. Does that make sense? Or they wouldn't have ordered ice massage. So in real life, though, you wouldn't get this piece. You would just have to look at it and go, let me look at that and see what we got going on. Okay, and then you would have to decide, do I want to do anything besides phonophoresis? Okay, and so that's where these scenarios break down a little bit. We're trying to make sure you can do all these little pieces. In real life, just to be perfectly honest, I would go, okay, doctors ordered phonophoresis. That's probably all I'm going to do with that shoulder. I can't bill for ice massage, so maybe I am doing a hot pack to the low back, but maybe I'm doing education with him on fall prevention while he's getting that, and I'm also doing some education like on maybe I'm printing off some shoulder exercises that he can do on his own while at home, and I'm going over those with him so that I'm using that time pretty well. And probably either finishing or starting with phonophoresis depending on what his pain level was with that shoulder and whether I wanted to knock it down before I did PNF or whether I wanted to knock it down at the end.
So phonophoresis and ice massage are both going to give you some pain relief.
Mm-hmm.
So if I wanted to do phonophoresis first to take him out of pain, get that medicine worked in, and then do the range of motion and PNF, that would be acceptable. Because then I can say, I'm going to finish with ice. He's going to lay down. We're going to do heat on his back. I'm going to ice down the shoulder after the exercise.
That would be perfectly acceptable.
Okay.
That would be perfectly acceptable. My only thinking in that is with the back spasms, I want to treat that pretty quick in my mind. And so that's why I'm thinking ice, heat first, and then finish. But it's not a wrong answer. And you have a good reasoning, and I would perfectly accept that treatment, and I wouldn't even say anything about it because you're not wrong at all. It's just different people.
So you might ask the patient, like, where's his back pain at? Where's the shoulder pain at? And if the back pain is like a 2, maybe it's not as urgent.
Right, and how they're moving, and some of that you even watch as they walk in. Is he kind of holding his back? Is he bent over? Is he kind of shuffling along? Then you want to hit that back pretty quick. If he's moving around pretty good, go ahead and get him, and then you can finish with it. So you leave him kind of happy with the back.
So could you do the PNF in the chair? So like say you started with ice massage, so you did it all, and then you could do the PNF in the chair before you went
Yeah. Yeah.
to the table?
Yeah, you can do PNF in the chair, sure. I mean, I do PNF in the chairs a lot. Yep, and that's where, yeah. And so some of those things it tells you, but in real life you're not going to know that. And so I want you guys to kind of start thinking like that. If it gives it to you, great. But then you're still explaining, his back pain's so high, and you still need to ask them and get that information anyways, right? You're not just going off of what the chart says, okay? But, yeah. So, anyways, ice massage to right shoulder, PNF, D1 and D2 for that right shoulder, progressing to active range of motion if tolerated. So we know we're starting with passive, right? And then maybe working to, it says active assistive, sorry. So we know we're doing active assistive where we're helping him, and if he's able to, then we can do it on our own. But obviously, since this is pretty fresh, we're not doing resisted, right? Okay? And then you won't know this part, okay, but it does tell you shoulder is 4 out of 10, low back is 7 out of 10. So definitely, in my thinking, once the patient told me that, I'm hitting that back pain right away, immediately. So, I mean, I would. I mean, that makes the most sense to me. So.
Brent, with that too, though. So if you're having them do the hot pack first, and so say you put it on while they're sitting in their chair, and then you went to do the ice massage, isn't that kind of hard to like check it as well because you're preoccupied trying to massage with the ice and clean up the water?
So what I would do with that, good question, Katie. So what I would do with that is I would get them set up with the hot pack first. I would set my 5-minute timer, and then I would gain any other information I need, okay? So like first thing right out of the bat, I'm asking him, how are you doing today? What's your pain level, right? I know his pain, he's like, pain in my back is 7 out of 10. At that point, I'm like, I'm treating your back now, okay? Stop all the other stuff. Go get the back, go get the hot pack. Make sure you do your precautions for heat, obviously, okay? Come back, get them set up with the hot pack. Then you can do anything else you need to do. Ask your questions for ultrasound. Ask your questions for ice. Gain any other information you need to gain, okay? And let that get you your 5 minutes. Does that make sense? Then after 5 minutes, you just have them lean forward a little bit if you can, and you kind of check that area. Remember, if they're leaning against it and it's in, you probably want an extra layer or two, okay? So instead of starting at 6, you might start at 8, okay? And then you have that 5 minutes to check. Then he's going to put it on back on for another 15 or 20 minutes, right? So then maybe you do your ice massage, okay? And then you don't have to worry about it. And you just say, let me know if it does start to have any issues. Go ahead and do the ice massage while that's going. And then you've got another 5 to 10 minutes still to do like PNF or something with them before you move them into transfer training, which is probably, honestly, looking at this, all that you would need to do on top of that is, okay, let's do some transfer training. And in that transfer training, I would do, in real life, some education on fall prevention, which you guys haven't really studied a lot, but. Is that?
If they were having lower back pain,
You can.
and if you decide to do that, would you do a belt up here since they're back too?
Yes.
Yeah.
Good question. Good question. Yeah, if their back's hurting pretty low and it's lumbar back pain, you can put the gait belt lower, but you're running the risk of bothering them, and so you can kind of ask them. That's where maybe even as you're checking out that pain, you're feeling a little bit. If it's pretty sensitive, okay, then yeah, you're definitely going to want to put that gait belt up higher, and maybe just period. Just because you know that area is inflamed and hurt, you just might go, I'm going to put this up higher, and here's why I'm putting this up higher, because I don't want to hurt the area that's already hurt. Good thinking.
And it doesn't tell you, but are we just assuming we're leaving the patient in the chair when we're done?
So this is set up more like an outpatient setting. So my thinking on that would be, I would do some transfer training with them to and from a bed or plinth, okay? Making sure that they're safe, making sure they have the gait belt on, making sure I'm training them on all the proper things. And then I would finish with them actually in the wheelchair, if they're in a wheelchair, so that they can go back on about their day.
And when it says educate about pain and inflammation, what exactly are we doing? Like, what should be said about pain and inflammation?
So what would you tell somebody?
It's like,
What?
Oh, to follow their pain
Yeah.
meds?
So make sure you're following your pain meds. You can let them know that it's okay to do a hot pack at home, right? But that they need to be careful in how often they can use that for treating their pain.
Talk about heat versus ice.
Right.
information.
I mean, you could talk to them about that, why you did ice on the shoulder versus why you did heat on the back. But just, make sure that they're aware of any, there's not a lot actually that you would have to teach them. Just let them know that, if something is inflamed, you don't want to put heat on it. So if your back feels like it's starting to swell up or get worse, don't keep heating it. Maybe move to an ice pack or something like that. But it's just to show that you understand the differences in those two. Does that make sense?
yeah.
Since you can't elevate a shoulder, would you tell them maybe sleep with an extra pillow so you're a little bit more elevated, or no? With rice, because you can't really do that necessarily with a shoulder versus a hand or a foot, but
I wouldn't worry about it.
okay.
Mostly shoulders stay pretty elevated just
Right.
because of where it is on our body. So
Okay.
does that help? So what we'll do is we'll at least do this with each of the scenarios. I will also go over your final, like your written final, and I'll look over the scenarios again. In fact, I read over the scenarios and I don't like them. So I'm going to adjust them to where they're more like, almost exactly like these, but not the same things, obviously. They're strange to me because they were set up by people before me. And these are just pretty much like your other ones were, and they were all the same, but on the final one they're a little bit strange and different, and so all those things that I said for you to know are still going to be on there, so it's not anything for you guys to stress or worry about. But I am gonna look at those two, is all I'm saying. I'm gonna make some adjustments to them to make them a little more user friendly and less scary. Because honestly, if I had pulled one of those in there, I would have been like, I would have panicked. So I'm definitely gonna make some adjustments to that, just so you guys know that. So what we'll do though is like each next class we'll go over those. And then for that final class, we'll just have time where you guys get to practice all of them, and I'll walk around and answer any other questions that come up. Okay? But we'll at least go through them where I talk through each of them with you two. Okay? Is that good?
Yes.
Does that help?
Yes.
Okay. All right, so we're a little bit over. You guys are free to go, but if you can stay and help put stuff away, I would really appreciate it.